everyone. We're just waiting for everyone to get logged in before we get started. Okay, we're going to go ahead and get started. Thank you everyone for joining us. This is the COVID-19 Health Equity and Immunization Fund webinar. I'm going to turn it over to Patricia, who will provide Spanish interpretation for us today. Patricia, would you please give instructions?
Hola, buenas tardes para todos. Estás en el seminario web de los fondos de inmunización y equidad de salud. Por favor, asegúrense de apagar su micrófono, apagar su cámara. La interpretación iniciará en un momento. Coloquen sus preguntas en el chat y asegúrense de hacerle clic al icono en forma de globo si usted desea interpretación. Buenas tardes, que tengan una gran reunión. Thank you.
Great, thank you, Patricia. Would you mind just giving those instructions in English as well? Oh, I think we turned on the interpretation. So I'll just do it for you, Patricia. So everyone will see a small globe on their Zoom, and you will need to select that and then select which language you would like to listen to. If we're good to go. All right, we'll get started. So welcome everyone. My name is Emily. I use she, her, hers pronouns, and I am the Equity Resource Supervisor at CDPHE. I am joined today by a few of my colleagues. I have Johanna and Adri, who are resource specialists, who is going to help facilitate the webinar. And we also have Tyler, who is our fiscal support. And we also have a few others on the line to help answer questions. So, all right. So, as a reminder, just please mute yourself during the webinar and turn off your camera. If you do have questions during the webinar, please write them in the chat. We'll get to as many questions as time allows today, but we will answer all questions in writing, including those we do answer and those that we don't have time to answer today. And those will be posted on our Health Equity Funding webpage. Johanna, can you please put the website link in the chat for everyone to find that page later on? All right, so today we're going to go over a few things. First, we'll start by reviewing the brief overview of the Disease Control and Public Health Response Health Equity Branch. We'll also talk about the Health Equity and Immunization Funding Opportunity, followed by the application instructions, and at the end we'll answer all of the questions that we can in the chat. So the Health Equity Branch is new. It was created in June of 2021, in response to the COVID-19 pandemic. The branch is part of the Disease Control and Public Health Response, which is often referred to as DECIPHER, and is a division of the Colorado Department of Public Health and Environment. The Health Equity Branch has 6 units, which you can see in the small squares at the bottom of the screen, to achieve our mission to expand and promote equitable access to opportunities and resources that impact an individual's or community's health and right to be free from communicable diseases and their health effects. This funding opportunity lives within the Equity Resource Support Unit. So what is the health?
Emily, I'm going to interrupt you for a second. We're hearing your mic is cutting in and out a little bit. A few people are noting.
Oh, okay.
To get yourself a little closer to the mic.
I will lean in. Thank you.
Thank you.
Yes. Let me know if it gets better, and I'll just be awkwardly close to the screen here.
That looks great. Thank you.
Okay, great. Thank you. Okay, so the Equity Resource Support Unit is composed of Equity Resource Specialists. Johanna and Adri are both current Equity Resource Specialists. These specialists provide technical assistance to organizations during the application process, throughout the life of the grant, and post-award. So each grantee is assigned an equity resource specialist depending on the applicant's geographic location after they're awarded a grant. However, applicants who would like assistance during the application process can also receive support to help submit their application. So to be assigned an equity resource specialist, you can email us at this email address in the slide, but I'll also ask Johanna to put the email address into the slide. So again, if you have any questions when you're putting together your grant application, please email us and we can set you up with a resource specialist to help answer any questions. All right, so let's move on to the funding opportunity. So this funding opportunity is a competitive process, meaning applications will be scored and funding will be given to top applicants. The rubric for scoring can be found in the request for applications, or the RFA. And the RFA is found on our website, which is the first link that Johanna put in the chat. The funding opportunity has two different components. One is the Health Disparities Grant, and the other is the Immunizations Grant. The Health Disparities Grant, which you will see abbreviated as HDG, provides funding to address health disparities in populations disproportionately impacted by COVID-19 and immunizations, which is often referred to as IMM. This funding is to increase COVID-19 vaccination rates across the state. Throughout this webinar, we'll talk about the specifics of both of these two grant programs. So each grant program has specific goals. The Health Disparities Grant, or HDG, has 3 goal areas, which you can see on the screen here. All applicants applying to the HDG grant funds will need to demonstrate how they meet at least one of the goals listed here. Again, the HDG funding is specific to addressing health disparities in populations disproportionately impacted by COVID-19. All applications will also need to be linked to COVID-19, which can be directly or indirectly. And we will talk more about what this means later on. Local public health agencies that are interested in receiving funding under this program must demonstrate that COVID-19 relief funds they have access to do not cover the proposed activities. Our second funding area, Immunization Grant, or IMM, has 6 goal areas, which are listed on the screen and are specific to increasing COVID-19 vaccinations. Increasing vaccinations can be achieved in a variety of ways, and all applicants applying to IMM grant funds will need to demonstrate how they meet at least one of the goals listed here. Again, all applications will also need to be linked to COVID-19. Local public health agencies are not allowed to apply for IMM funding. So again, local public health agencies can apply for the Health Disparities Grant, but not the immunization grants. All right, so many agencies and organizations are eligible to receive funding, and the list will continue on the next slide as well. However, all applicants must be Colorado-based, and those organizations with ties to disproportionately affected populations are encouraged to apply. And we will review how we define affected populations in a few slides. And here is that continuation of the list. I will say that the list on these 2 slides are not necessarily all-inclusive. So if you do not see your organization type listed, please email us and we can check to see if you're eligible. Agencies that have already received funding from CDPHE or the Center for Disease Control for the same work are not eligible to apply. So if you are currently receiving funding from CDPHE or the CDC and have questions, if you are eligible for this funding, please email us and we can work with you. All right, so as I mentioned, we are really focused on funding disproportionately affected populations. Our unit defines affected populations as the ones listed on this slide. In addition to working with these populations, priority will be given to organizations that demonstrate already having strong ties to the communities for which they are requesting funding, as well as organizations serving rural and geographically isolated areas. In this funding, we will also prioritize funding for organizations that utilize culturally and linguistically responsive programs, demonstrate strong and trusting relationships with affected communities, and those that engage the target community to inform programming and services. Right, so we have 4 different categories under our funding opportunities. So now we'll talk about what those program areas are under each funding opportunity. So our first program area is our community engagement program. This community engagement program is part of our health disparities, our HDG funding. It is recommended applicants start with this funding category if they cannot demonstrate an understanding of community identified needs and assets. The purpose of this funding category is to develop a deeper understanding of community specific assets and needs related to current and future COVID-19 recovery efforts. The focus is on relationship development to identify community leaders and understand community needs. These funds are really not intended for robocalls or literature drops that lack a personal connection to the target community. It's really about developing an understanding and building relationships. Our second program area, which is also under our Health Disparities Grant funding, is the Community Health Navigators program. Community Health Navigators are also sometimes called community health workers or promotoras. This program area is specific to conducting patient education, vaccine outreach, and health system navigation related to COVID-19. Community health navigators differ from direct service providers because they work to build relations and trust in disproportionately affected communities to provide appropriate information and help navigate social systems, including wraparound services, resource and referrals. This program area does not include providing individual clinical services. So individual clinical services would not be an approved activity under this. Applicants who wish to provide community health navigator training are eligible for funding. However, priority will be given to organizations that have established community health navigator programs. All right, our third program area is also under HDG funding, so the Health Disparities Grant funding. This program will support partners affiliated with and who provide service to disproportionately affected populations that are under-resourced and at a higher risk for COVID-19 to implement evidence-based programming that address social determinants of health and overall well-being of the community. Organizations that do not currently have evidence-based programming are encouraged to implement the Colorado Resilience Framework. And if you don't have access to that, we can put a link in there. Johanna, would you mind putting a link to the Colorado Resilience Framework in the chat? So funds in this program can address direct and indirect impacts of COVID-19. Initial efforts should focus on supporting individuals and families who experience a COVID-19 infection through delivery of wraparound services to ensure the immediate needs of the family are met. These are considered direct needs. The secondary focus includes providing services of a similar nature to the community who are experiencing impacts from the pandemic that are indirectly tied to COVID-19 cases. This can include staff providing assistance, finding housing, or filling out food stamp applications. However, funds cannot be used to pay for rent or for food. So this is really providing services and assistance and not directly paying. All right, our final program area is our health equity immunization events. This is the only program area under our immunization or IMM funding. The goal of this program is to improve vaccine education, outreach, access, and administration in communities. Priority will be given to fund community-based organizations or leaders that have existing relationships with and or that have established capacity or reach in the community they are trying to vaccinate. This funding is intended to support community leaders, coalitions, and local health clinics and centers. And once again, this funding is not available to local public health agencies. So those are the four program areas we have under our funding categories. And next we'll talk about the funding application and budget. So funding will be available until June 30th of 2024. All activities and funds spent need to be completed by this date. There is approximately $22 million available in funding. One very specific thing is there are no caps in the amount of dollars an organization can request, as we encourage organizations to apply for the amount based on organizational capacity and community needs. We do have recommended ranges in our funding request for applications. However, these are suggestions, and we do really encourage organizations to apply for what they need. Large organizations that wish to apply for a larger amount of funding and then disperse to smaller entities are also allowed to do so. So through this grant, funding is primarily cost reimbursable, meaning grantee fund expenses upfront and then the state reimburses approved costs. Grantees will be responsible for providing expense documentation such as receipts and payroll for reimbursement. And our team of resource specialists are available to help support organizations in submitting invoices for reimbursement. This grant opportunity does allow for the inclusion of indirect costs. Unless your organization has a negotiated rate with CDPHE already, the indirect cost rate will be 10%. So we do have available advance payment, and this is available on a case-by-case basis. Up to 25% of the total award may be given as an initial payment to assist selected applicants with launching approved activities. If you are requesting advance payment, you are required to prioritize your budget expenses on the project budget and narrative under the advance payment tab. If you are not requesting advance payment, you do not need to complete this section of the budget. And in this tab, there are additional instructions and information on how to prioritize your budget. Not all applicants nor all budget expenses are eligible for advance payment, so please pay special attention to those instructions. After an advance payment of 25%, the remaining funds will be given on a cost reimbursement basis only. This means that the selected award applicants must be financially able to pay for expenses and then request reimbursement from CDPHE. We are still finalizing the eligibility and process for this option, and more information will be provided as it becomes available to those selected for funding. If advance payments are not approved, then all funding will be distributed as a cost reimbursement, as I talked about earlier. So one of the most frequent questions we get is allowable and unallowable expenses. On our website, there is a document that discusses allowable and unallowable expenses. So when submitting your budget for this grant opportunity, please pay close attention to the allowable and unallowable expenses document. This can also be found as the Exhibit B in the request for applications. So the slide highlights some of the most frequent questions we receive regarding what is allowable and unallowable, but additional guidance is provided in the document located in the RFA. If you are planning to include incentives such as gift cards in your budget, please carefully review the incentive guidelines found on our funding webpage. And we highly suggest you reach out to us and our resource specialists to help fully understand how to apply for incentives. All right, so now we are going to move on to the application components. So as previously mentioned, there are two funding sources in this request for applications, and applications will be accepted on a rolling basis. From August to October, we will receive and review applications monthly, and then move to a quarterly review. Applications will be reviewed and scored after the application period has closed. Please note that the Health Disparities Grant funds end sooner than the immunization funding, so please plan accordingly with your applications. Funding may be extended, and we do encourage organizations to check the Health Equity Funding webpage periodically for updates. So the first component of the application is the program application. So in the application, one application contains both the immunization and HDG funding opportunities. Applicants may apply for multiple program areas under the Health Disparities Grant in one application. So as you may remember, there are 3 different categories under the Health Disparities Grant. You can apply for all 3 under one application. If you are planning on applying for both health disparities and immunization funding, you must submit 2 separate applications, which includes 2 separate applications, budget, and timelines. So you may use the same information to answer the general non-program specific questions on both applications. So let me just say that again. So if you are planning on applying for both health disparities and immunization funding, you must submit 2 separate complete applications, one for health disparities and a separate one for immunizations. However, you may use the same information to answer the general non-program specific questions on both applications. Please remember that all applications must be linked to one of the or more of the grant goal areas we discussed earlier, and all work must be linked to COVID-19. So the program narrative, please be sure to answer all required questions. As I said, all program areas are in one application. So you just need to answer the questions that relate to the program you're applying to. Incomplete applications will be sent back to applicants, and applicants that have their application sent back may resubmit completed applications during the next funding round. There are both general required questions and program specific questions depending on what program areas you are applying to. And again, you only need to answer program specific questions for the programs you're applying to. If you are confused or have any questions, please contact us so a resource specialist can assist you. The second component of the application is the work plan or outline of activities. This is an opportunity to show how you plan to complete the objectives and work outlined in the application narrative. Please completely fill out the outline of activities. This is a general outline and can be changed during the contracting process if you're selected for funding. The work plan provides a narrative for how your organization plans to carry out the proposed work in your program application narrative. Right, the third component is the project budget and narrative. The project budget and narrative should tie directly to your work plan and outline of activities. So for example, if your work plan outline says you will hold 4 community events to gain community input, your budget would reflect the cost of hosting community events such as printing and staff time. As food and beverages are not allowed under this grant, those items would not be included in your budget. You may add more rows to the budget template, but please do not change the template headings. The project budget should be for the number of months you need to implement your work plan and not include specific dates. As I mentioned previously, incentives are allowed, but must be approved by both the Colorado Department of Public Health and Environment and the Center for Disease Control prior to purchase. If you plan to include incentives, please work with a resource specialist prior to submitting an application to learn more about that process. The final component of the application is the financial risk assessment. The financial risk assessment is mandatory, but has no impact on the application. This is a tool to help CDPHE determine the amount of support your organization may need during the life of the grant award. Please make sure that your financial risk assessment is answered completely. So once your application is complete, please send the grant narrative, the work plan and outline of activities, the budget and financial risk assessment, all in one email to the email on the screen. Please carefully review the instructions for submitting, including the title of the email and how to label the documents, which is found in the request for applications. Okay, so now we will talk about how applications will be reviewed and awarded. Complete applications will be reviewed by CDPH staff and scored based on this rubric. This rubric can also be found in the request for applications. I suggest that you please refer to the rubric as you are drafting your application and budget to have a firm understanding of how we will score and rank applicants. Applicants will be notified no later than 35 days after the close of the application period. If your organization is not selected for funding, you may reapply during the next cycle. The state will not reimburse any costs associated with the work until after a contract is executed. This process can take multiple months after the notice of award. Grantees will be expected to participate in meetings with CDPHE staff, submit progress reports, and a final evaluation report. If you have any questions throughout the life of the grant program, you may email them to us at the email address on the screen. Responses will be posted on the funding opportunity webpage. So please periodically check our webpage for any updates. In addition, as I mentioned previously, any questions answered today, including those we do not answer verbally, will be collected and posted on the website. All right, so with that, thank you for joining us, and we will see what questions we have. Adri, do we have any questions?
Yes, we do, Emily. Some are in the process of getting answered by Kristen and Tyler. But there are a few lingering. One of the first questions is a formatting question. It says, when the application says each statement should be labeled with the original label for the document, does this mean the file name or attachment name as stated within the actual text of the document?
You know, I think that's a great question. And I think the best thing for us to do is we'll answer this online, and then we can write out how you would label that as an example for everybody.
All right. Our next question is, can an organization receive grants from multiple funding categories to fund different components of a larger overall project?
Yes, organizations can apply for multiple program areas. You would need to demonstrate how those program areas support different work outline in your work plan and activities so that you're not overlapping funding categories. But organizations can apply for more than one program area.
Awesome, thank you. The next question is about character count limits for open-ended questions. Is it just limited to the size of the text box, or is there a word limit?
There is a word limit. The application is in a Word format. So there is, the box expands as you type. So please pay close attention to the word count limit that is in the application.
Awesome. All right, another question we have. With multiple deadlines, could the total amount be granted before the last deadline?
Your total, yes. However, you would need to be able to expend all funds by the end of the funding period, which is June 30th, 2024. So the organization would need to demonstrate how they plan to spend the funds given that time frame, but they can't submit an application up to the last deadline.
Perfect. This next question, let's see. Okay, this question is, if you were a sub in a previous vaccine grant, will you be able to apply? Will you be able to apply as an individual organization?
Can you repeat that question, Adri?
Yeah, if you were a sub in a previous vaccine grant, will you be able to apply as an individual organization?
I believe the answer is yes, but I think it would depend on what kind of organization you are and the other funding you have. So I would suggest reaching out to the resource specialist to make sure that you're eligible before you put together a funding application.
Mm-hmm. Okay. There's a question about how, can you clarify how the HCP relates to the Colorado Resiliency Framework?
I'm not familiar with the Adri, did you say the HCP?
Sorry.
It's the Healthy Communities Program.
Healthy Communities Program, yep.
So the Colorado Resilience Framework is an example that the state uses as an evidence-based program. So organizations can use any evidence-based program that if your organization currently already has and adopted an evidence-based program, you're welcome to use that. So I'm not familiar if that is an evidence-based program.
Okay. There is a question about, is there more details that you can provide on the advanced funds?
Yes, it depends on what, I think if an organization has specific questions about advance payment, to reach out to us through that email so we can answer specifically for your organization unless they wrote in a specific question. As we mentioned, we're still setting up the program. So it's kind of is based on the organization and what their needs are.
All right. Scrolling through the questions here. Some of them are getting answered as we go about them. And just so you know, Emily, you're breaking up. You're coming in and out again.
Oh, okay. Sorry, I'll lean closer again.
We have another question. Let's see. Okay, there is a couple questions about just the overall funding, the amount. So one question is, would the 22 million be awarded before the final deadline?
We don't anticipate, but technically funds could run out, but I think that we don't anticipate and we encourage folks to apply for what their needs are.
Mm-hmm. Yeah, I think that goes along with that, the next question of how do I know there will be any money left by the last deadline? Could it all have been granted before the final deadline? That's right along that same response. Can our organization submit applications for both grants?
Yes, for both grant areas, you can submit applications for both HEG and IMM. However, you want to make sure you submit 2 separate applications.
Okay, perfect. This question is about approval periods. So is there a way to know how long the approval period will be after each application deadline? And also how long after approval funds will be available?
Yeah, so in the RFA, there is a table listing out when we notify applicants of award. After the notice of award, contracting can take up to 3 months after that initial period.
Can you repeat that last part? You broke up a little bit.
Yes. So in the RFA, there is a timeline of our process and when grantees would be notified of an award. After the notice of award, contracting can take up to 3 months.
There is a question in Spanish. It says, well, in Spanish, it says, la aplicación estará en español, which means, will the application be in Spanish as well?
We currently do not have the application in Spanish. However, we have resource specialists who speak Spanish and can assist organizations in their application.
All right, I see some more agency-specific questions here. So just as a reminder, we will review these questions and then get them back to you. Let's see. We have a question about, can you share a little bit about tracking outcomes and data collection expectations?
Yeah, that's a great question. So in the work plan, as well as a grant application, we do ask for specific objectives of your work and then how you plan to measure that in the work plan. So we really rely on organizations to tell us how they would like to measure their impact. In addition, at CDPHE, we do have quarterly progress reports that we require for everyone who receives an award. Those are mainly qualitative based, meaning that it's really just informational and not really collecting data at this point. So again, in the application and the work plan, it would be really up to the agency to define how they want to show that they reach their objectives.
Perfect. Looking for some more general questions here, one moment. There's a question about here. It says, I understand. Okay, so I think that there's a little bit of a misunderstanding here, but I will state the question so you can kind of address what that question is. It's, I understand we can pay direct expenses like rent. However, could we apply for funds to pay host homes for homeless LGBTQ youth to live while in transition? So I think we need to address the direct expenses.
Yeah, that's a great question. So we cannot use funds to pay for things like rent assistance or transition homes. What is an eligible expense is paying staff to assist community members in filling out applications or helping them navigate systems to find housing. So again, we can't pay for direct assistance such as rent, food, utility assistance, anything like that.
Okay. This next question is talking about timeline. They give an example. So it says, if an application is submitted by August 31st and the contracting takes up to 3 months, it sounds like December is the earliest start date for projects, correct?
Now hold on, let me think about the timeline.
There's a second portion to that question as well.
Sure.
It says, and the RFA states that the first funding period ends June 2023, which is only 6 months later, with the possibility of being extended to May 2024. Based on this timeline, should our project budget reflect only year one or a multi-year budget of up to 16 or 17 months?
So applications submitting at the end of August should only include their budget until the end of the funding period. Again, we're not asking applicants to state specific dates in their budget or work plan, but rather the number of months you are seeking funding.
Mhm.
So again, if our funding is extended and we do receive an extension, we can always extend a contract. But we do want to make sure that the applications are reflecting our current timeline with funding.
All right. This is a good question. Will partnerships and collaborations be looked upon favorably upon, or an organization with the capacity can solely apply? So I think they're talking about partnerships.
Yeah, that's a great question. So I think because this is a statewide program, we're really looking for organizations to tell us the best way to work with the communities that we're prioritizing and what works for them and what works in the community you're seeking funding for. So some communities are able to have multi-partnerships and really be able to address some of those social determinants of health that way. That's great, and we encourage collaborations and partnerships. There are some areas of the state where that's not possible and it's just one lead agency, and that would also be appropriate. So it just depends on what you're aiming to achieve and what works best for the communities. And then that would be reflected in your application.
Great. So I think this is a question probably a lot of people are wondering about, is how involved or time consuming are the reimbursement and reporting processes?
So if you have never worked with state or federal funding, it is a process. I will say that we do have the resource specialist, and their job is to work with organizations who are new to state and federal funding to really help support them in how to correctly submit invoices and documentation and the reports to make it as least difficult as possible. So our goal is to set you up for success in the beginning and make it easy so everyone, so it doesn't take a lot of time for everyone. But yes, because we are working with federal funds, there are certain requirements for both invoicing and documentation.
Yeah, thank you. There's been a lot of questions about the recording. When will the recording be posted?
That is a good question. As it will be posted when we can, I would say I would guess by next week, but just, so we can get it downloaded and posted to the website. So as soon as we're able to.
Awesome. So the other questions I'm seeing are a little more based on like specific agency questions, so we can address those through the website or through the email. And of course, your resource specialists are always happy to meet with you and talk through some of these questions as well. Let's see, I'm just going to do one quick look through. Let's see. There was a follow-up question about how involved the process is. I'm not really sure, Andy, about that question. If you can elaborate a little more. The original question is, how involved is the reporting process, and is that directly important for the state and federal invoicing to go well? I'm not really sure what that question is, if you can elaborate. Cadence. What is the cadence for reporting 30 days, quarterly, etc.? What is the reimbursement committed turnaround? Is it 30 days?
That is a great question. I'm going to ask Tyler, our fiscal person, if he could talk about the turnaround time for reimbursement.
Yes, sorry, I was paying attention to typing answers and whatnot. Can you restate the question?
Yeah. What is the cadence for reporting 30 days, quarterly, etc.? What is the reimbursement committed turnaround? Is it 30 days?
So the state of Colorado has a 45-day payment term. That being said, we rarely ever take that long to issue payment. Also depends on whether you are set up with the state of Colorado with an EFT direct deposit or if you're going to have your check mailed to you. Obviously, there are wait times as a check gets routed through the mail, and EFTs are much quicker. And we highly suggest that all vendors that work with us get set up with EFT direct deposit. Does that answer the question?
Yeah, I think one other question, Tyler, was can agencies only submit for reimbursement monthly, or can they do it quarterly, or is there a shorter
They will be
time?
monthly. All invoicing will be on a monthly basis. All reporting will be on a monthly basis.
Perfect. Thank you, Tyler.
Thank you.
And the instructions for setting up the EFT are also on our funding webpage as well.
All right, another question. Is the reporting process for activities part of invoicing?
They are separate activities, but both are required monthly, if that answers the question.
All right. This is a great question. I think maybe more than just James you have. So can we all have access to resources to help with reporting, even if we have experience with reporting to federal funds?
Yes, of course. You can also use the resource specialist. Anyone interested applying or receiving funding can utilize the resource specialist.
Awesome. All right, and then I just want to address Ibrahim. I see your question coming in about you applying as a community newspaper. We can chat with you a little bit more after the webinar to talk a little bit more about those details, as well as Lindsay. I see your question about a medical respite program. We can also answer that after the webinar to process some of that, get a little bit more information. I just want to acknowledge that I have seen your questions. All right, I'm not seeing any more in the Q&A. I think that's all the questions we have right now, Emily.
Okay, great. And as Adri said, if you had agency-specific questions, we will post the answers to that on our website. Just want to make sure that we have the specific information. You can always email us as well for direct follow-up. And if there are any additional questions as you're working on the application, please send us an email and we will get you in touch with a resource specialist. I'll just give it another few seconds just to make sure no more questions.
Let's see. Virginia, yes, we did answer your formatting question. Catherine. Catherine, you have a question about the Healthy Communities Grant Program and requirements, talking about wraparound services and things of that nature. Again, that's a little more program or agency specific, and we will answer that post-webinar. It's okay, Virginia. All right, looks like those are all the questions.
Okay, great. Well, thank you so much, everyone, for joining. I hope this was helpful and informative. And again, we will post the answers to the questions within 2 weeks. So thank you so much and have a great day.